Hi and welcome, I'm Dr. Behnam. I'm your hair transplant surgeon and I'll be performing your hair transplant procedure for you. I want to take a few minutes and go through the pre-op instructions that we have emailed you. So please print it out and go through it with me. Please go through it a few times and I will be stressing the key important points as I will be going along. One of the first and most important things I'd like to address are the cancellation day policies and rescheduling policies. I would like to inform you that you're the only patient of the day, and I do it on purpose so we give all the attention to you so you get great results. So if you need to cancel you or reschedule, please let us know 2 weeks in advance. First, I'd like to define the two different methods of doing this procedure. There's a strep method or FUT, but I'll be referring to it as strip throughout this conversation, and the FUE method, follicular unit extraction. So the strip method is when I remove a strip of tissue from the back of the scalp and I suture and close it. The FUE method is when I individually remove one graft at a time. So for the FUE method, the individual graft technique, I will be shaving the donor area. Now the donor area is the area that will be removing the grafts from. The recipient area is the area that will be putting the grafts in. So I'll be shaving this area. Now I will taper it so it looks good and natural, and a few days afterwards you will have your barber taper it as well. Now with regards to the strep method, I will not be shaving the back of the scalp. I will only be shaving a small portion which I will actually remove, and your natural hair will actually cover the wound area. So for the strep method, I do not want you to get a haircut for at least 1 month prior to the procedure. I would like you to leave your hair at least 1.5 inches long. Now what could you do to make your hair grow out faster after the procedure? There's a special protein shake and multivitamin developed by Dr. Larry Shapiro that I would like you to read about before the procedure. His website is helphair.com, and I have experimented this on many patients, and you only have to do it for 6 months and your hair grows out much faster. So please look into it. Pain and discomfort after the procedure. The pharmacist will deliver Tylenol with codeine to the practice on the day of your procedure, but I would like you to get Tylenol over the counter. It comes as 300 milligrams in addition to ibuprofen 200 milligrams, or ibuprofen is the same thing as Advil, so it doesn't make a difference. So the Tylenol and Advil is just fine. What to wear for the day of the procedure? I would like you to wear long sleeve shirts that are loose, right? I don't want you to wear something that is too tight. It's a long day. So long sleeve shirts, long sleeve pants if you can, that are loose. Things that are not too fancy because you may have to toss them afterwards. For women, I would like you to wear a sports bra. That's very important. Good blood pressure, systolic, which is the number on the top, is between 120 and 140. So if you take any blood pressure medication, I would like you to take it at the exact same time that you take it every day. So if you take your blood pressure medications in the morning, please take it in the morning before you come. This is very important. And please monitor your blood pressure for a few days prior to the procedure. If your blood pressure is too high on the day of the procedure, I may give you a blood pressure medication to reduce it, or if it's too high, you may have to cancel the procedure. If you take thyroid medications, please also take the medications at the exact same time. That's very important as well. Medications to stop prior to the hair transplant procedure. Those include medications that actually increase bleeding, like Advil, ibuprofen. So please stop those medications. So if you take those for pain discomfort, you could substitute it with Tylenol. Tylenol does not increase the bleeding, and that is fine. There's some prescription medications like Plavix that also increases bleeding. If you do take that and I do not know about it, you need to let me know. If you take aspirin, you also need to stop it for at least 1 week to 2 weeks prior to the procedure. For Advil and ibuprofen, also 2 weeks prior to the procedure as well. If you take vitamin E or multivitamin, please stop them 1 week before the procedure, but it's not as mandatory as with ibuprofen and Advil. If you take Rogaine, please stop it 2 weeks prior to the procedure as well. Please avoid any sunburns or tanning booths prior to the procedure. For the strip procedure, you will need to do a special scalp exercise on the back of the scalp. So how does it work? Well, you clench your hands together, you put on the back of the scalp, and you physically move the skin up and down for at least 30 minutes a day. Also remember, you take your palms and you put it on the temples and move the skin up and down. Now you don't need to be doing it 30 minutes continuously, but 3 minutes at a time, but it's very important that you do it for at least 30 minutes, at least 1 to 2 weeks prior to the procedure, and I'll let you know exactly how many weeks you need. But a few days before the procedure, I would like you to do it for at least an hour a night. The more you do it, it helps better, and that's actually very important. Some people go to a masseuse and have the masseuse do it. Some people do it while they're in the underneath the shower. That helps out. Some people do it when they're on the bed. They just put their hand on the back of the scalp and pull the skin up for about 5 to 10 minutes and pull it down for about 5 to 10 minutes. The scalp exercise is very important. It minimizes the amount of discomfort and pain you're going to have, and also minimizes the scarring as well, and allows us to get a lot of grafts. Alcohol and the procedure. Please avoid alcohol for 1 week prior to the procedure. Traveling to the office on the day of the procedure. Please keep in mind that we live in Los Angeles and traffic starts building up at around 5:30 in the morning, especially we are in Santa Monica. So please put our address in your GPS the night before to estimate when you have to get up in the morning to come to the office. Our address is 2825 Santa Monica Boulevard, Suite 303A in Santa Monica 90404. Now there's also a building in downtown LA that's 2825 Santa Monica Boulevard. So you have to put the city Santa Monica, otherwise it will take you to the wrong location. Parking on the day of the procedure. The parking below the building, the entrance is on Santa Monica Boulevard. Please park underneath for the day of the procedure. Now parking for follow-ups. So on the same block as the building, there is a motel, it's Best Western, and we have a special arrangement that you can park in the parking lot way in the back. The entrance is on Harvard Street, so this way you don't have to park underneath the building because the fees are really high and there's very limited parking on the street in Santa Monica. Follow-ups after the procedure. I would like to see you the day after the procedure. So for the next day, you don't have to make an appointment because you may be sleeping late. So please come to the office after 1 p.m. For subsequent follow-ups, since I would like to see you and give you a very individualized plan just for you, we need to see you at least multiple times. So for those times, please make an appointment with my office staff secretary, and at those times you also will be getting the laser treatments. Now, if you just want to come for the laser treatments and you don't need to speak with me, you could make the appointment at any time throughout the day, in the morning or the evening. But if you'd like to speak with me and go over through some planning, please, we have very specific times that you could make the appointment after 12, some after 1 or 2 o'clock, depending on the procedure I have for that day. So please contact the office. Medications to take to minimize bleeding. So vitamin K is very important. It comes as either vitamin K1, vitamin K2, 100 milligrams, 125 milligrams. You could buy it at Whole Foods, and you take either the 100 or 125 milligrams, doesn't make a difference, 3 tablets, 3 times a day, 5 days prior to the procedure. It's really not that much of vitamin K, right? Because some people take 1,000 to 2,000 micrograms a day just for their joints. So that's very important. No marijuana for 1 week prior to the procedure. no exercise on the morning of the procedure. You could exercise all the way to the night before, but please make sure that your exercise the night before is not too strenuous. The night before the procedure, please make sure to wash your scalp as well as wash your scalp the morning of the procedure as well. We will wash it again here with the antibacterial solution. Now, for those that work in a hospital setting, that means if you're nurses or doctors, or you have a family member that works in a hospital setting, you need to get a special antibacterial solution. You'll get from any pharmacy. It's called HibiCleanse, HibiCleanse. And I would like you to wash your scalp with the HibiCleanse. In addition, your entire family members, I would like them to wash it with HibiCleanse as well prior to the procedure. Transportation to the office, please don't use any bus on the day of the procedure, but Lyft and Uber are great. You know, it's a long day, and I think they are great options of transportation. You also have a hotel next door, and if you feel you want to spend the night here, that's great. I would love you to eat breakfast before you come in. Now let me exactly define what I mean by breakfast and what kinds of breakfasts are not sufficient. So I will be giving you medications. I'll be giving you Tylenol with codeine, antibiotics, prednisone, sometimes Xanax or Valium. So you'll be receiving few medications, and sometimes it may cause stomach upset. So please eat well before you come. So a bagel and cream cheese is good, it's solid and it's pretty good. What is not okay is just fruits or a protein bar or just a shake, right? Or a juice. So those are not sufficient. So please eat pretty well, like few eggs, you know, that's actually very good as well. Please do not watch any YouTube videos before coming in. It's not what you see on YouTube. It's actually a much more relaxed environment and goes very smoothly. No swimming for 4 weeks afterwards, no coloring your hair for 4 weeks afterwards. If you want to color your hair, you can color your hair a good 1 week before. If you have gray hair, I typically color your hair on the day of the procedure. I just want to stress important things to get prior to the procedure, which is ibuprofen as well as a neck pillow. That's very important. I also like to just go through a few things that may delay hair growth. Number 1, smoking. So cut down on your smoking. Number 2, things that cause trauma to the grafts. Like for example, you know, please don't schedule skiing events or bungee jumping. These, you know, can cause trauma. And also significant weight loss. So I would not want you to lose a significant amount of weight immediately after the procedure, because you're depleting basically your grafts of the nutrients, and that's actually very important. Thank you very much. I'll see you on the day of the procedure. If you have any questions, please let us know. Contact us directly.